already know that there is a J-shaped curve linking alcohol consumption and mortality and morbidity of cardiovascular diseases. We will hear a very interesting presentation regarding cardiovascular diseases and health. There are also some other diseases in which the beer consumption is not at all banished. On the contrary, it can bring some very interesting positive elements like diabetes, type 2 diabetes, and also some diseases that are linked with old age, like different types of dementia.
The idea that you would need beer on a regular basis, a predictable basis, to attract people to a central location is a really powerful one. There's also no coincidence that as soon as people could write, they started recording the things that were most important to them, like beer. The Mesopotamians were using beer to pay workers. It was an incredibly integral part of their life. There's dozens of different words for beer, different kinds of beer recorded. This integral connection between people and beer is obviously something that we still have with us today.
We know that it's very important if we choose to drink, that it's much, much better to drink with food and at meal times than it is to drink on an empty stomach. It is surprising how few guidelines take this into account.
Peripheral arterial disease, here again, moderate beer consumption is associated with a lower risk. These are data from the Framingham Heart Study. As far as the J-shaped relation with coronary heart disease and other conditions like diabetes, the scientific evidence has not changed. It's just how we answer the right question.
This is the current knowledge about the effect of alcohol in general for many sorts, beer or wine or other spirits, on human health, presented several times today. This is the J-shape association. It looks like a J function, a parabolic function, in which moderate consumption seems to prevent from various causes of death. Beer consumption had a significant protective effect on cardiovascular disease.
For beer, it was the same amount, 20 to 30 grams of alcohol per day, and it caused a reduction maximally around 9%. You can see that the BMI, which relates to the overweight, it is decreased if you have the daily alcohol intake compared to occasional. In conclusion, light and moderate alcohol and beer consumption reduce the incidence of type 2 diabetes. Moderate intake of beer with alcohol does not increase the risk of low blood glucose in people with type 2 diabetes. So I would say moderate use of alcohol and beer is acceptable for those with diabetes.
We see also that beer is one of the most consumed beverages worldwide, and it could prevent Alzheimer's due to two different components. We have hops as well as silicon.
The total mortality is reduced perhaps differently in men and women, but certainly it is reduced. Alcohol contributes effectively to the beneficial effect of Mediterranean diet, and there is no other single component of Mediterranean diet which contributes so much as the moderate alcohol consumption.
There is a window for a moderate alcohol, beer and wine consumption that is healthy.
We often forget that food and drink also have a hedonic part. We are drinking, we are eating not only for nutrients, but also for pleasure.